Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. Which of the following conditions is least likely to cause osteoporosis? A. Steroid therapy. B. Prolonged weightlessness in space. C. Hyperparathyroidism. D. Hypoparathyroidism. The correct answer is option D, hypoparathyroidism. Option A is not right because long-term use of glucocorticoids can lead to osteoporosis. Option B is not right because lack of gravity causes bone density loss due to reduced mechanical load on the bones in space. Option C, hyperparathyroidism, it leads to increased bone resorption because of the secretion of excessive parathyroid hormone, which results in osteoporosis. A female patient with angina is referred to the clinic after a total knee replacement. The patient has a history of angina, which is usually relieved by rest and intake of nitroglycerin. The pain occurs with increased activity or stress. Based on these details of information, the patient has which type of angina? A. Unstable angina. B. Variant angina. C. Prinzmetal angina. D. Stable angina. The correct answer is D, stable angina. This type of angina is related to myocardial demand. Option A is manifested by angina at rest. Options B and C refer to the same type of angina that is related to coronary artery vasospasm. An infant is diagnosed with correctable talus equinovarus involving the right foot. The physical therapist expects the following corrective interventions for the patient except A. Manipulation, B. Casting, C. Splintage, D. Cincinnati incision. The correct answer is D. Cincinnati incision. An easy or correctable clubfoot deformity is managed with manipulation, casting, and splintage. Surgery is indicated to resistant clubfoot deformities or to deformities that fail to respond to non-operative interventions. Options for incisions include the Cincinnati incision and turco-curvilineal medial or posteromedial incision. Open chain exercises or closed chain exercises are usually part of the exercise prescription given to a patient who is referred for exercise therapy. Which of the following activities is classified as open chain exercise? A. Biceps curl, B. Squats, C. Push ups, D. Leg press. The correct answer is A. Biceps curl. This is classified as open chain exercise. Open chain exercises involve movements in which distal body part such as the hand or foot is allowed to move freely. Whereas options B, C and D are closed chain exercises, and these exercises involve movements in which the distal part is fixed with the proximal body parts moving around it. I hope this video would have been useful to you all. For more such videos, stay tuned to our channel. Thank you.